Because adenomyosis is also the growth of this endometrial tissue. When it starts growing inside, deep in the womb or in the uterus cavity, in the uterine cavity, in the womb, it becomes a medical condition too, sickness that can cause painful cramp or dysmenorrhea. Then another one is PID, painful inflammatory disease caused by infections. It is caused by infections. When this condition happens, it will interfere with the normalcy or integrity of the womb or the uterine cavity. When the womb starts suffering the problem of this pelvic inflammatory disease, it also causes painful menstruation. Another one is cervical stenosis. Cervical stenosis, that is cervix, when the cervix is narrowed. If you look at this diagram, you see that the cervix is from here to here. These are the cervix. Then this place is called internal os. This is the external os. Then when something blocks here as a cause from infection, when it blocks the internal os, it will narrow it. When it narrows it, then when the endometrial tissue in the womb or in the uterus shed its menstrual blood, it will find it difficult to pass through this cervix, which may cause uterine inflammation, that is, the womb will be inflamed. It may lead to infertility. It may also lead to cervical cancer if not treated. It also causes painful menstruation. Another one is the risk factors. It's not every factor that is a positive factor to this condition. Most of the factors are risk factors. The risk factors are those things that we do or that we may engage in that may result in our standing the risk of having this condition, which is dysmenorrhea or painful menstruation. One of them is age. A woman that is 35 years and 30 years without gestation or without being pregnant has a tendency of having the risk of painful menstruation. Another one is early onset of puberty. Early onset of puberty is also a risk factor. When your puberty starts from 11 years down, it is a risk factor. You stand the chance of having painful menstruation. Another one is heavy bleeding called menorrhagia. When you bleed heavily during your menstrual cycle or menstruation, it can lead to painful menstruation. The next one is irregular bleeding. When you bleed irregular, like 2 to 3 times within a cycle, you can stand the risk of having this condition, painful menstruation. Then we have family history. Family history is a situation where your grandmother had this condition, your mother had this condition. Now it is your time, you are going to have this condition or you have it. Family history is also a predisposing factor to this condition. It's a risk factor. And don't forget that heavy bleeding is called menorrhagia in medical terms. Irregular bleeding is also called metrorrhagia. Don't forget it. So my brothers and sisters, my fans across the globe, this brings us to the end of this video today. In the next video, we are going to talk about the signs and symptoms of this condition, the preventive measures, and the managerial, how to manage it, that is managerial procedures, how to manage it. So please, I want to urge you once again, share this video. Let it go viral. Let it get to the point, to the people that needs it or need it. Let us save life. There are those people that need this information. They need this knowledge. Let us share this video, please. Like it. Comment on the comment section for the benefits of our sisters, our vulnerable relatives. Thank you so much for sharing.